Our goal is your satisfaction. Let us show you the way.
When does internal OS open in pregnancy? Between 37 and 42 weeks of pregnancy, the cervix tends to shift forward, pointing toward the front of the vagina. It gets softer and starts to widen and open, also known as dilating, and thin, or efface. If this isn't your first baby, the cervix is already softer and a little more open than a first-time mom's. What is OS in pregnancy ultrasound? Endocervix. Mucus-producing cells that form the upper two-thirds of the cervix. External OS. The opening on the outermost, vaginal side of the canal. Internal OS. The opening on the innermost side of the canal near the uterus. What is OS in internal OS? The external OS. The opening in the center of the ectocervix. The endocervix. A passage that connects the vagina to the uterus, also known as the endocervical canal. The internal OS. The opening into the uterus from the cervix. What does OS mean in cervical OS? The internal OS of the cervix is the opening of the cervix that joins the uterus, while the external OS of the cervix is the junction between the cervix and the vagina. During labor, the internal OS will undergo effacement, while the external OS will undergo dilation. How far should the placenta be from the internal OS? Conclusion. Trial of vaginal delivery is appropriate in cases with a placental to internal OS distance greater than 2 cm. The term previa should be restricted to cases where the placental edge is less than or equals 2 cm from the internal OS, as the likelihood of operative delivery and significant postpartum hemorrhage is high.
Take our lead. Let's help you make your mark.